Councilor Keenwell, how are you guys? I'd like to call the meeting to order for the District of Chetwynd. Can I have the opening statement read?
As we gather today on the traditional territory of the Treaty 8 Nations to conduct the business of the District of Chetwynd, we do so knowing that we are privileged to serve the citizens of this community, and we shall endeavor to conduct our business in their best interest. Thank you.
Yep, thank you. Prior to adoption of the agenda, is there any new business from council? Staff? We're good? Okay. Adoption of the agenda, please.
Motion to adopt.
Second.
All in favor? Any opposed? Okay, carried. Minutes of the regular council meeting held on April 7th, 2025.
Motion to receive.
Second.
Any discussion? Any errors or omissions? Council, staff? All those in favor? Any opposed? Carried. All right, we have the pleasure of a couple delegations today, and the first delegation will be Little Prairie Community Forest, Inc. Update of the operations, Helene Weightman.
Good afternoon. I'd like to introduce our general manager, and he's going to give the presentation.
Okay, thank you, Helen. Step to the podium.
Sorry.
Introduce yourself.
Okay, yeah. So my name is Derek Dick. I'm the general manager of Little Prairie Community Forests, and I've been there for just over a year now. And we wanted to take this opportunity to come here today and just give everyone an update in terms of what we're doing and some things that are coming up here shortly. So it'll be a short presentation, but I just have a few slides here. This first picture is just a intro here. We updated our sign here last year. And so that's what that's all about. So, okay, just because. Not going. Nope. Oh, there we go. Okay. So, the Little Prairie Community Forest is undergoing an expansion. This has been ongoing now for a number of years and has been stalled in various times throughout its history. But right now we're actually we're about ready to submit the application. And so we wanted to make sure that the District of Chetwynd understands what's happening here. So the area to the right where it's outlined in black, that is the original community forest, which began, I believe, in 2010, I believe. And more recently, the area that shows to the north and to the east, which is a yellowy orange color, that is the TLE lands of Soto First Nations that are going to be removed from the community forest. And that's also been ongoing. And so this whole process takes that into account. So the boundary is going to be amended to remove that area, which is approximately a third of the area of the original community forest. And so when this was proposed, the community forest was promised to be compensated with new areas to compensate for the losses there. Also, a number of years ago, government also promised that the community forest could have an expansion which could make it more viable. In recent years, as everyone knows, the mountain pine beetle had a significant impact on our cut. It probably dropped by over half. So that's significant. The loss of the teal lands also has an impact as well. So the area to the blue, which is to the west of Chetwynd, is our proposed area. And we've been in talks with both First Nations are all our partners in the community forest and Chetwynd, and as well as government. And this is the area that we've come up with at this point in time to expand the community forest. So when this gets approved, it'll increase our opportunity, our profitability, and it will benefit all three partners going forward. Do I ask for questions now, or
Yeah, it's your presentation. If you are open to questions, we
Yep.
can go ahead and have questions.
if there's anybody who has any questions, please feel free.
Hey, Derek, the new area there that's opening up, is that or being applied for, is that gonna affect the gun range at all?
No, I don't believe so. The gun range is, if you see in the middle of the original community forest area, there's a piece that juts in quite a bit from the bottom. That, in fact, is the gun range. And so the gun range is actually only a small portion to the bottom. It extends significantly beyond that area, significantly beyond the gun range. In addition to that, there's also an old growth management area that extends beyond the gun range, or extends into the community forest as well. So it's well protected at this point.
Thank you.
I do have one just for our audience here. What's the purpose of a community forest? Because we have three partners, right? Chetwynd, Soto, and West Mulberry. What is the purpose? And what have you? Are we going to learn anything from the community forest?
Yeah, that's a great question. So there's a lot of benefits in having a community forest. So for starters, the province of BC decided to implement the community forestry program to bring benefits to the community. So it allows communities to be kind of in the driver's seat in terms of the area that they manage. It provides significant revenue to all the partners in our case over time. It provides revenue for us to invest back into the community forest and the community. So, for example, one of our main mandates is education. So we're working hard to provide opportunities for anybody, especially students, to become educated in a variety of things, whether it be forestry, wildlife, nature, First Nations culture, traditions. We're constantly expanding our ideas and programs in terms of how to do that. And an example is in May, we're going to have a bird watching day on a Saturday. We're going to advertise to the public, and whoever wants to come, an employee from West Fraser who's a biologist is going to conduct the day, and so that's kind of what we're after and why we're doing what we're doing here. So yeah.
Derek, did you have students in there prior to, let's say, today? Like, was there any in the past here? Have you brought any of the schools in there?
Yeah.
The grades?
Yeah, for sure. So last year we had 2 school groups out. We had, if I remember right, it was the Mowbray Lake Elementary School we had out for a day. It was kind of a career forestry day. West Fraser helped out. So we had the kids out and we showed them different things, measuring trees, plant identification. We actually had some small seedlings and the kids went up and planted trees all over the place and they had a blast and it was actually really successful. We had another one last year with the high school and we walked down the trails and looked at plants and talked about ecosystems and wildlife and how it all connects that way. This year, and I'm going to have a slide to show, we did some logging up there this year, and we were able to have 2 different school groups up there to do logging tours, it actually worked out really great. And the kids were able to get close to the machinery and see, the logs getting moved around, and we talked about the management and we talked about jobs and jobs for boys and girls and all the opportunities that are out there. And so I think it opened a lot of eyes because some of the kids aren't exposed to that, right? So we felt that it was really, really good. And we had a wiener roast afterwards at the picnic shelter there that we've improved recently. So it was a great day, and we have more plans to do this year as well, so, or continue.
One more about the walking trails. Who manages that? Do you, does the Hello Prairie Forest take care of that?
Yeah, for sure. So our trails and the district's trails kind of connect in certain places, but we kind of have an imaginary line where we look after our half.
Yeah.
And so, yeah, we are. So all the trails right around the picnic shelter up towards the Tony Fazekas trail, and we're doing some connections there to make some of these connect. And so, yeah, we're looking after those. We recently did some danger tree work in there. We're plan is to mow a couple times a year, make sure the trees that are coming down various times are picked up and moved and whatnot. So, and we also have a plan to, now that things have been maintained to a pretty good level, we're looking at doing some of the grooming for cross-country ski trails in the winter. So we've had some issues in the past. Chetwynd Outdoor Society had some stuff up there that got stolen, and so that kind of interrupted things. And so we're going to take it over, and we're going to hopefully have, as long as we got good snow, hopefully we'll have some good trails up there. Yeah.
Did you have any other slides?
Yeah, we covered some of this, so there we go. So yeah, again, this is the community forest top, near the top there. You can see the highway heading to Moberly. The blocks in red are what we harvested this winter, and those mature stands that needed to be harvested, we were able to salvage 6,000 meters of pulp out of it, which was sent out of town, which is great because otherwise that would just get piled and burned. So we actually were able to turn some of that dry wood into revenue, so that was really good. And the other reason we chose here this year was to mitigate some of the risks of fire coming if we were to have a fire come from the west moving to the east. We had some very highly flammable stands in there that would have been a problem. So that's what we did this year. And the other thing that we're looking at doing is disc golf. I've been talking to a company that is in the business of designing disc golf courses. And so we're just kind of at the preliminary stage, but the area in red is kind of the area that we'd be looking at putting in the course, right near the top there. That's the shelter where you drive off the highway. So we're hopefully gonna start that this year, and that's pretty exciting. So we'll see how that goes. And I think I had one more. Yeah, so this is a quick rundown of the trail systems here. So everything in red is a trail. And so on the right-hand side there, that's the shelter with all the small little loops and things. And then the red road that extends to the left is the Ghost Mountain Road, and it connects to the Tony Fazekas Trail, and then to the bottom there, it connects to the Mount Bali and all the other trail systems there. So just kind of a overview there. I think that was the last one. Yes. Any other questions?
Yeah, signage. I know that you're going to go around and round in some of the trails.
Yeah.
How's the signage?
So that's another thing we're working on. Andy and I are kind of tasked with that right now. And so we're going to be putting up a number of interpretive signs. So basically walking along the trail, there'll be these little plaque-like signs, and we're going to be talking about plants and animals and ecosystems and hopefully some cultural information. We hope to have some QR codes on these signs that you can actually scan, and it'll take to a website with more information. We're still kind of coming up with ideas, like maybe we might even have it go to like a little presentation or some little talk that that some potentially an elder or something can give and give more information about, what's gone on in this area in the past and some of the important features that are out there that most people may not know about. So it's ongoing. We hope to have some actually erected this year and more as time goes on, as we kind of get it moving forward. So.
Any questions? Go ahead, Councillor Nelson.
Thank you for your presentation there. I believe that in the past, the community forest was primarily run by volunteers, board of directors, and it's great that we have you in position now. When you talk about doing trail grooming and such, do you have staff, or are you going to be out there doing all the grooming yourself and getting the cross-country trails in order?
Well, I am the staff. Well, I'm a contractor, but at this point in time, it's either myself or if I need help doing it, Andy's also agreed to help out with the trails. Like if you get a dump of snow on a Friday night and somebody needs to get out there Saturday morning to do some trail grooming or something, Andy's just down the road kind of thing, and he can jump in and do it. So pretty much at this point, it's just me and whatever help I need from the directors. Now, we obviously hire contractors, to do various things, whether it's equipment or, some of our forestry plans and that sort of thing. We hire contractors to do that. But the day-to-day stuff is more in my hands. Yeah.
Thank you. I just kind of wanted to follow up on the cross-country ski trails because the sport is near and dear to my heart. And when that skidoo got stolen from the Outdoor Society, we were stuck without any tracks, and kind of the cross-country skiing in Chetwynd came to a halt. And I'm just hoping that you and your team can resurrect that for next winter.
Absolutely. So the plan is in place, and we do have one of the groomers was stolen as well. So we have to have one of those made again. But we've spoken about it a number of times at our board meetings and whatnot, and it's important. And if we get the snow, there'll be trails this coming winter.
Thank you.
Okay, thank you very much. When will we see you again for another presentation? Because it sounds pretty interesting. That I'd like to see I'd like to hear about the progress.
Well, we are having a meeting here. When is that?
We have a shareholders
Yeah.
meeting in May, but I think a general meeting reporting back
Yeah.
to mayor and council, sorry, they'll stand up,
Mhm.
should be probably in the fall.
Yeah.
I would think September, October, give us 6 months so we can get all of our plans together and actually implement them.
And we're always available if you have questions.
Okay,
Easy to get a hold of. So.
can anybody get a hold of you?
Yep. Yep.
Okay, perfect.
Yep. You bet.
Yeah. Okay,
Thank you.
thank you very much.
All right. Thank you.
Fair, yep. Very interesting stuff. It's always good to have delegations because sometimes our meetings go and then we're gone. But when we have presentations, we get to hear from the general public on what we have here in Chetwynd. And the next presentation is going to be from Northern Health, Rebecca Borton. Go ahead and state your name, position.
Thank you. I'll try and find a height that's going to work for both of us. There it is. All right, Rebecca Borton. I'm the Health Services Administrator for Chetwynd, also supporting Tumbler Ridge and Hudson's Hope through my journeys. With me today is my co-leader, Dr. Braun Finkelstein, and together we oversee our services here at Chetwynd. Let's do a test here. There it goes. So we came today, we spoke with you about a year ago around this time. And so, I think it's always a great opportunity to come back and take the temperature. Where are we at? What are we working on? Where do we see ourselves going?
Was that a pun? Was that a pun? Take my temperature?
Healthcare jokes. So we have a number of services that we offer within the Chetwynd sphere of our organization, but I'll start off with our community and primary care. Quite frequently, we tend to zero in on our hospital and our emergency services. And I don't ever want to have the opportunity to overlook our community and our primary care, because this is the care structure that supports you from birth through your life, chronic disease management, mental health, maternity, perinatal care, palliative care, diagnosis and treatment. You're visiting your physicians regularly in a primary care system. It's preventative and it's longitudinal. So I wanted to acknowledge that this is an important part of our care system here in Chetwynd. So what does primary care look like in 2025 for Chetwynd? So we're going to continue to support the area with our team-based care plans, coordination of care between multiple providers, entry points within the system. We know we have folks out there that are accessing services not always at the local level. How are we coordinating their care, moving them through the many transitions that you may go through as you receive care? Another important part, we added this last year, is our transition bed. So this is a bit of a unique piece. We've delved into this in some of our larger centers in the Northeast, but we're very excited to bring it on board here in Chetwynd. It's a partnership with Swears Place, which is our assisted living facility. We have a bed and a unit there that is funded fully through Northern Health, but we use this as a stepping stool or a point of entry, either into our facility or out of our facility and into community care. So you may see clients going in there that are waiting for a home renovation. Perhaps they live quite a ways out of town and maybe don't have all the facilities that they need as they're recovering from something, but they don't necessarily need an acute care bed in our facility. So this transition bed, I think, is going to become a very, very important piece for us moving forward. And it allows our community services a really close access point to folks that may exist farther geographically. We're going to continue to support the primary care network. And Bron, did you want to highlight some of the upcoming pieces around our PCN?
Sure. So primary care networks are fairly extensive throughout the province, but it's something that the South Piece in particular has been kind of lacking. These PCNs, they run through divisions of family practice, and until just recently, Chetwynd, Tumbler Ridge, and Dawson Creek did not have a division of family practice, so they didn't have kind of a membership into this PCN structure. We were recently granted division status for the South Piece. So Chetwynd, Dawson Creek, and Tumbler Ridge are now the South Piece division, which lets us play ball in this PCN kind of game, which is really important because it comes with a lot of funding and support from the Ministry of Health. I believe prior to the South Piece, the most recent formation of a division was over 10 years prior to that. So we're quite, I guess, junior in this domain, and have a lot of catch up to do. But what it does is it comes with new resources. So it comes with additional physician allocations. So you can have more physicians taking on attachment and having patients in a region. It also comes with like network funding so that the communities can work better to integrate services such as maternity care between communities, especially those that don't provide intrapartum maternity care within their community. Ancillary and interprofessional team positions as well. So things like dietitian, social work or social work assistant, either rehab assistant or kinesiology, different positions that can support community health. And I mean, just thinking about the presentation we just had from the community forest, I mean, these are opportunities for us to utilize incredible natural resources and things that are really good for health promotion and getting our community healthy and maintaining that through these primary care network structures.
Thank you. Other programs that will continue, obviously, to see our support will be our vaccination immunization programs, increased wound care within our community services team, and of course, continued attachment and access to a family doctor for that longitudinal care. So what are our key priorities as we move forward? And I've sort of italicized this one because I would list this as our first and second priority for our community services, is our increased physician attachment and access to a family physician. We know over the last year, this has been a challenge as we work to balance some of our service interruptions in the ED, providing balanced and appropriate work schedules for all of our team members. And looking into 2025, we're going to have the ability to turn more closely to our primary care access, which is pretty exciting. We'll continue to onboard our new primary care network members, as Ron highlighted. One challenge for us inside community going forward is going to be our space allocation at the primary care clinic. We developed a partnership with the District of Chetwynd. As many of you know, in 2015, we were provided with an absolutely gorgeous facility to operate our primary care services out of. We've continued to maximize on our footprint. We've had a number of conversations over the last few months about how we are being more efficient with this footprint. How are we incorporating our new physicians into there, along with our new team members, providing everyone with the space that they need to appropriately work. This is going to be a challenge continuing forward. I think we're at a place where we're managing, but it's something to continue to watch. And I'm happy to invite anyone from council that would like to pop down and have a visualization of what that looks like and how we're using that space. Case coordination and home support expansion for those aging in place will also continue to be one of our community priorities. I'm stuck. Can you bump me ahead a slide? Thank you. Chetwynd General Hospital. So what does it look like up there over the last year? So we've continued to welcome a number of new staff over the past few months. 2 new RNs. When I typed up this PowerPoint, that should now be 3. We've just welcomed another one. We've had 2 LPNs join our team. We have casual medical imaging and lab staff, care aides, facilities maintenance, housekeeping. All of these departments have seen an increase. Physical changes have occurred. So our trauma room, washroom upgrade and repair was completed last year. Completion of the physio space for our rehabilitation needs, and that's where our physiotherapist and our occupational therapist are working out of when they touch down. Our new call bell system has been installed and is functioning quite appropriately. We're very excited about that one. The AC upgrades for our lab have been complete. And we have now completed our remote registration relocation. So you'll see that if you've come up to register after hours, you're no longer registering at that very front first desk. You're coming into the building a little bit more and offering you a bit more confidentiality and privacy as you register. So I'll continue off my slides, maybe when we get the visuals back up. Additional equipment planning is underway. So we are very generously supported by our hospital foundation and very appreciative of all the work and efforts that they do in the background, along with the community that comes alongside them. So last year we saw the addition of a number of equipment priorities. We have 2 new ECG machines, a bladder scanner, 2 Zoll defibrillators, and a variety of other small pieces of equipment were added to our repertoire. And I'm going to allow Ron maybe to comment on some of that and what that means in terms of particularly physician recruitment and retention.
Yeah, so I mean, equipment is pretty important for us to be able to do our job effectively, both the physicians and our nursing colleagues. I mean, obviously having like high quality ECGs lets us make critical decisions based on patients who are presenting with chest pain or heart attacks. And then some of the other equipment just really goes to support the group. I mean, bladder scanners are used every single day. We also have an ultrasound machine that was fundraised by the hospital foundation that we've been using for a couple of years now. And it's really provided significant point of care testing for our physicians. And some of this supports our nursing team, some of it supports our physicians, but I mean, at the end of the day, it's all going towards a team being able to work well with machinery and equipment. We have some other like small equipment that's kind of just not listed in detail here, but things like being able to check a patient's eye pressure in the emergency department if they come in with a painful red eye, or you know, some of our equipment that lets us look at suspicious skin lesions. Like, it's actually pretty awesome, the equipment that we have and what we can do for our size. We're pretty small, but we're pretty mighty for the resources that we have available.
Yeah, and again, I'll just acknowledge that a lot of that is supported at the local level through our foundation. So thank you to everyone who works alongside them. We continue to see an average admittance rate of about 160% with our ALCs, as we refer to them. These are those folks who are awaiting long-term care placement. So we continue to see a number of folks admitted in an acute care bed that are awaiting a long-term care bed. And we have seen a significant reduction of the use of agency staff, which was one of our goals for 2024. So what are our priorities coming into 2025? Service interruption and diversion management and reduction where possible. Patient access and flow. This is the patients moving through the system to the most appropriate care or provider or unit in a timely manner. We know if we're holding folks, the ALC is one really strong example. If we're holding folks in an acute care bed, that means that we can't admit someone to acute care bed. So having people move through our system in an efficient way is going to continue to be not only a local goal, but a regional goal. Our nursing education expansion. We've been working on this for a number of years. We have a number of Earn While You Learn programs. That's the EWL abbreviation that you see there. One that is new to us that we advocated for very, very heavily at the local level was the transition from a care aide to an LPN. So we'll see our first individual go through that pathway starting here in the next few months. And hopefully there'll be a return for service with that, and they'll return to us in about 16 months. This is a really exciting, I'm passionate about these things, but I think this is a really exciting pivotal point because you're starting to see a progression from, entry into care aide, entry into LPN, transition into RN. There's a laddering that's developing there. And I'm a huge advocate and fan of anything that we can do to help bridge these educated professionals into further careers and skill sets. So really excited to see this one hit the ground. Of course, our HCAP recruitment will continue. That's your care aide, where you enter in to an agreement and you're paid a living wage as you obtain your certification and then provide a return for service. Additional priorities, our gynae room improvements that will continue. That's your first room into the ED when you come in, it's on to your left. So there's a number of things that we'll be looking for over the next few months there. A new Earn While You Learn program will come to us in the form of a rehab assistant. Also, again, a really exciting opportunity. And we have an individual enrolled in that right now, and they'll start their education in the coming months, returning to us in 2026 with a return for service. This rehab assistant will work closely with our physiotherapists and our occupational therapists to provide hands-on rehab support for those who are admitted within the facility, hopefully reducing length of stays, returning folks to their baseline as is an ongoing goal. And of course, ongoing recruitment, retention, and support for those that are doing the hard work on the front lines. I'll turn it over to my colleague for the physician update.
So these numbers actually have some updates since the slides were prepared. Maybe just for a bit of backstory, we had a couple of physicians leave community last year, including one that left unexpectedly under medical circumstances. And so we were basically reduced to 3.8 of our 5.5 equivalents, full-time equivalents of practice, which put a lot of strain on those of us that were still here. Thankfully, we have been able to recruit back up to the full 5.5, not quite 5.5, 5.3 of the 5.5 FTE. So we have 6 docs in 5.5 positions. So there's 2 doctors not quite working to full-time due to other circumstances. And then what this Chetwynd Primary Care Clinic full-time equivalency really means is because these are Northern Health contracted positions, this is really the workforce that is guaranteeing that the emergency department is running on a day-to-day basis. We do have contribution from another physician in community, which is greatly appreciated, who's currently working outside of the Northern Health contract situation. And then there is also the Northern Nations Wellness Center, which is providing primary care services, but at this time is not providing facility-based services. So really, it's a big improvement to go from 3.8 to 5.3. It allows for some more resiliency and redundancy. And what we learned quite painfully last year was that a community is very vulnerable to losing even one physician, and it has a really big impact on the availability of all the other doctors because, one person's full-time work spread amongst 4 others really limits their ability to be in clinic and in the emergency department at the same time. Going back to the primary care network that we mentioned at the beginning of the slide, that also comes with physician equivalents through the primary care clinic. So we have the ability to add at this point an additional full-time equivalent, which we have currently posted. Another important piece of our recruiting and retaining strategy is involving medical learners in our community. So we have a full-time resident physician who is not included in the numbers I've mentioned so far. And we've actually matched another full-time resident physician that'll be starting in July. So we'll have 2 learner resident doctors who are, they've graduated medical school, but they have to do their 2 years of residency training before they can practice independently. So it's really empowering for a community to be able to be involved in teaching learners. It also increases the likelihood of those learners wanting to practice in a community, either the same community, we hope, or a similar community in the surrounding area. And Tumbler Ridge benefits from shared teaching of these residents between Chetwynd and Tumbler Ridge. So it's also good for community building in our region. Let's see, is there anything else I didn't comment on here? Hospital and emergency department coverage, it's always a balance, right? So we have a certain number of physicians who are providing both facility-based care up at the hospital and clinic-based care. Can't be in both places at the same time. So it's a matter of balancing how many days somebody is in clinic versus how many, hours they're spending up at the hospital and overnight call. So we're working to balance that and hopefully, strike a happy medium. And obviously having a higher number of full-time equivalent positions gives us that resiliency and redundancy so that if somebody's off, somebody becomes ill, it doesn't catastrophically impact access to healthcare.
So let's have a look at our workforce and our vacancy rates. You'll see a color sliding scale there that represents all of Northern Health. We're located obviously in Peace River South. The overall NH vacancy rate right now is 20.33%. My local vacancy rate is 12.9. So we're considerably below the average, and I'm very excited to see that. Obviously, still more work to go there, but these are good numbers. What is our vacancies and where do they sit right now? We've listed 4 nursing as of publication of the slides. It's now down to 3, 1 MP position and 1 Indigenous care coordinator do still sit vacant, although I do anticipate some hiring in the future quite quickly in some of these. So these numbers will continue to improve. Net gains over the last year, because of course the workforce evaluation is always fluid. Some are coming in, some are going out, some are shifting from full-time to casual to part-time to full-time. But overall, we saw a net gain of 10 regular employees over the last year, which for a community of this size is a significant gain. So new faces over the last year, many have local roots and connections in Chetwynd. We know research tells us that this is a significant indicator of a length of stay in a community. And so this is a very encouraging fact that a number of our folks are very well connected in this community. We continue to see travel and agency nurses, and I've got another slide that speaks to that, particularly the use of our Go Health team. What are our vacancies in terms of RNs? That should be 5 out of 9 lines with 1 casual. LPN lines are all currently filled. Caring lines all currently filled with a very generous casual pool. Laboratory and diagnostic imaging all filled at this time. We recently did see a bit of a dip in our diagnostic imaging, but we have been able to correct. Do you have a question?
Vicki, yes, just to, for clarity, what is a line?
Yeah.
When you say lines, what does that mean to
A
us?
line is a position. Yeah, and so the line might be a 1.0 FTE, which is your full-time, or it might be a 0.5 FTE, which is a part-time line. Local staff continue to go above and beyond in picking up shifts and trying to work hard to make sure that any service interruptions that are on the horizon are being mitigated. And I can't acknowledge this point loudly enough. And so everyone who's here, who might be reading this or seeing this later on, the tremendous amount of work that our local frontline providers are doing right now to try to stabilize and equalize our services is incredible. And your stats don't actually begin to reflect that, but I just wanted to share that very, very quickly, that it is our frontline providers and our frontline staff that are really turning the wheels right now. So let's take a look at our agency staff. And then we have got some data going back to January of 2023. You can see there's some highs of highs and there's a few lows.
Sorry, Becky, do you want to briefly just define agency?
For sure. So your agency staff are typically an RN, although we have used other demographics for agency. These are people that are contracted. They're non-unionized. They don't hold a regular position with Northern Health. And so they work wherever sort of the world takes them, and they have a number of locations and places that they may travel to. We've relied very heavily on the support of agency staff to sustain our services. And I'm extremely encouraged to see this number decreasing. And I do project it to continue to decrease as the year goes on. What that means is that we're transitioning people into regular employment. And so when I pulled the data on this one, I'm pretty excited to see that number decreasing. So where are our staff coming from? We've talked about our regular staff that are filling our lines or FTEs. Where are the gaps? How are they being filled? And this is our Go Health team. So your Go Health, they're also travel-related employees, but they're regular employees with Northern Health. So they are in regular lines. They move about the region. They move about the province. They have the ability to travel and be flexible with their schedules. But they do frequently choose Chetwynd as their work site. And so this is a very encouraging stat to see us transitioning out of the use and dependence upon agency staff and into our regular team and into our Go Health team, which is also a subsidiary of our regular team.
And then from a healthcare provider perspective, this means that we're working with people on a recurring basis and we're getting to know them more. They're getting to know our community more, as opposed to just coming in for a week or a short period of time and then you never see them again. It means that they're more familiar with our context and our environment, and then we're all able to deliver better care as a team. Agency also tends to be kind of a for-profit based business model, whereas the Go Health is actually like health authority based, like sustainable provision of labor. So it's kind of a different philosophy of approaching filling these positions, and I think Becky's captured that well.
So difficult to fill positions. Currently 6 are open. I would take that down to 5 with our recent hire last week. Our average time to fill a difficult to fill position is 143 days. That's slightly better than the average across the province. Historically, you can see some data there going back to 2015. We saw the spike starting in 2020, 2021, 2022. And then 2024 is starting to come back down, and projecting that to continue to decrease as the year goes on. Average length of service is 4.9 years inside this community. And you can see the light pink is the actual count for Chetwynd. The purple is your expected count. So that expected count takes an average of a number of factors. And so you see in a number of the demographics, we're beating the average. Again, promising indicators, and I'm really happy to see where this is trending. So let's talk about some service interruptions. So what is a service interruption? We've talked a few times before about this, but for those that may need to know, a service interruption means the emergency department cannot accept new patients, and those who require emergent or urgent care must be redirected to another facility. It can mean that other units and other departments within the facility continue to operate as normal, and it can mean sometimes an impact into these other services as well. And there's complexity there. The top 3 reasons that we see a diversion or service interruption for Chetwynd, and these change over the years, but in the last year, 2024, the most common reason for an interruption was related to physician availability. And that is striking that balance between the number of providers that we have, the time that they are in primary care providing longitudinal care, and the time that they're in facility providing urgent care. We've been significantly challenged in the last year to balance that, and are projecting going into 2025, whatever is wood around here, that we are going to see this improve coming into the new fiscal. The second most common reason for a service interruption in an emergency department in this community is related to patient acuity or the number of patients that we're serving at that time. This is a very, very complex metric. It can be very complicated and it can unfold in real time. So it may mean a multi-person MVA has come in and all of our nurses and physicians are attending to those folks. It may mean that we are delayed in some reason for transferring a patient, could be weather related, could be availability of BCEHS, and our patients are being held who we really need to see them be somewhere else, and they're requiring all of our services in that area. The third most common reason in 2024 for an ED diversion or service interruption would be a vacancy for some reason related to an RN. And this can be a variety of reasons. It can be just a vacant shift, a vacant line. It could be a sick call unexpectedly, but it can also be that our RN staff have volunteered to go out on a transfer with a patient. And we do see that occurring quite frequently within this community. And again, I'll go back to those frontline providers that are working very, very hard to get our people what they need. And so they regularly volunteer to jump in the back of an ambulance and go with that critical patient to get them to a higher level of care. In doing so, it can place us on an interruption while that RN is out of community. So some historical data and some statistics for you. So total number of service interruptions for 2022, we were sitting at 96. 2023, 104. In 2024, we were down to 65. Again, projecting that number to continue to decrease as our provider levels have come.
Can I ask a question?
I just have a question in regards to the EDs. When you're measuring them, are you measuring them by day, like each day that this occurs, or by individuals that you turn away, or segments of time?
Yeah, so we use a provincial guideline to measure them. So we want service interruptions to be measured consistently and in the same way across the province. And the metrics that have been given to us is an event. So you may see if it's a nursing related diversion, a 12-hour interruption because that's the length of time of a nursing shift. If that's a physician related diversion, it may be a 24-hour block because that is the length of shift for a physician. So it's not measured in hours, it's not measured in days per se, it's measured in event. And the number of hours are reportable through our system into the ministry. So how do we continue to manage this? And what strategies are we looking ahead to? It is that ongoing schedule adjustment, and that happens both for RNs and for physicians. Again, this is my repeat mantra, but I just can't acknowledge our team enough in the ways that they put their hands up and work so very hard to try and block and fill gaps that we may have. We continue to use Go Health staff predominantly, with some agency staff continuing as well where we need them. We're looking at staffing levels to allow the EDRN to focus solely on the ED, so increasing the other folks who are in the building to offset some of that coverage, allowing the EDRN to focus on the ED side. Of course, calling in extra staff, sometimes it comes from other communities, and we're very grateful for those people and their support. ongoing recruitment efforts, working to transfer patients in a timely manner. We have a number of transfer partners that support us with that. We are challenged at times within our region where, the weather is what the weather is some days, and sometimes that does impact our ability to move people. And of course, our physician recruitment and retention. One last slide, and this is one that, I tend to dive into a little bit as well on my end, but you're looking at the acuity of patients that present to an ED. So your CTAS level 1s are your highest acuity. We don't always see a lot of those, and I'm thankful for that. But you do tend to see, your level 2s and your level 3s are consistent metric that we can continue to monitor. So that's your level 2s are your red line, your level 3s are your blue. Right around sort of COVID, you started to see, a bit of an uptick there in both measurements, and that's been persistent since then. So what do I extrapolate from this data? There's a number of things. My key takeaway is that we have an opportunity in primary care. This is displaying opportunity to get ahead of people, their chronic disease, their longitudinal care, preventative management, and get people in front of the care providers that they need before they need to present to an ED as a CTAS 2 or 3. I'm happy to take a couple of comments and questions if your time allows for it. I know I've had a long presentation, but
I'm certain that the council will allow more time for questions.
Just as a point of order, you should make a motion to extend.
Okay.
Motion to extend the Northern Health presentation.
Second.
All those in favor? Carry. Questions? Councillor?
Just one sort of thing, if someone goes out of the area and you end up in another hospital where you're going to visit someone there's always seems to be fairly a lot of security. Are staff comfortable here without security around, or are they safe?
Yeah, it's a very, very good question. We have a lot of conversation at the local level around this. Many of you know our facility was designed in the 60s, built late 60s, opened in 71. Our layout can be challenging when looking at security. It's a very, very open and easily accessed and entry. That being said, we have a number of strategies that we do employ on our end around security. Some of them involve, systems that happen in the background around flagging risk, reporting risk, communicating risk, and managing risk. So 2-person visits, noticing patient behavior more acutely. We do secure our doors after a certain point in the evening, where you do have to buzz to enter into the facility. That's another strategy that we use. We do have the ability to contact our CMP quite quickly, on our end, and a number of other strategies. Cold white drills we do regularly, cold white being our emergency response to an aggressive or developing situation. Do they feel safe? I can't speak on their behalf. I do know that they regularly bring concerns forward, and we do reach a resolution around them. And they continue to feel comfortable to raise those things with us.
And maybe I'll just say, I think we feel very well supported by our RCMP colleagues as well. We're kind of uniquely positioned in that you have to go past the police station to get to the hospital. There's not a lot of hospitals that have like a one-way past a police station. And their response time is excellent, and we've always been very well supported when we've needed kind of basically security or safety related emergency support. The RCMP members have been exceptional colleagues.
Thank you.
Councillor Smith.
My question is, with more doctors coming on staff, does that mean residents in Chetwynd will be able to get a family physician easier in the future?
Yeah, and I have a bit of data I can share around that. And I know the lived experience, particularly in the last year, has been challenging. And I pulled the data this morning, so wait times to receive a visit, and this can vary across providers. It depends on what you're coming in for and which provider you're seeing. But we're booking right now somewhere between April 30th and May 8th, which is a significant increase from where we were at quite recently. We have approximately 300 people on our wait list to attach to a physician. Each physician carries what we call a panel, and that's their group of patients that they care for. A physician panel may range, and it depends on their FTE, but it may range from about 400 to 500. So having 300 people on a wait list is essentially, another physician, which we have recently added. So I'm anticipating that wait list to decrease significantly over the coming months. And as I shared earlier, focusing in on primary care access is a key priority for us in the next year.
Thank you.
You're welcome.
Trustee Nelson?
Thanks for your presentation. My first question, I have a couple, but what is full-time hours for a doctor if one shift is 24 hours?
Over the course of a year, one full-time equivalent is about 1,700 hours.
Amazing. And there's a bit of a paradox in a little bit of this information in terms of the 2015 build of the primary care clinic and saying the footprint is just simply not large enough yet. While it seems so difficult to get in to see a doctor in the primary care clinic, and it's just a bit of a paradox where you're saying you are full. But the last time I went to make an appointment, I actually made an appointment to make an appointment.
Mm-hmm. And I think that speaks to how quickly in a small community you can see things shift. So ergonomically, space provision, we did have space throughout the last year, but it was because we didn't have physicians in those rooms doing what we needed and what they wanted to do. Moving forward, the addition of 2 physicians, with the addition of a resident, with the addition of the primary care network, new net FTE, with the expansion of a few other areas like our home support program, which is continuing to grow. They're all sharing the same footprint. And so some of the strategies that we've employed is the buddying up of physicians and sharing space. It is the mobilization or the ability to flex our nursing staff around the facility. One of the limiting factors when we look at space inside this building is the access to the ability to wash your hands, which is very important in healthcare. So when this facility was built, the water installation was put in sort of half of the building, not in the other half. And I believe the intention with that was that half would be offices and wouldn't require hand washing facilities. As we look to maximize our space, we've explored the opportunity to install water within these spaces. And it's actually proving quite challenging given the way that the building was constructed. So we are limited to what services we can offer where because of the hand washing facility.
That's very interesting. And of course, we want to see enough doctors for our community. So what do you feel like the next step is? Is it an addition? Is it a new build? What are you going for?
I think at this point, we need to see where our current status lands us. We know that we're tight. We know that we're trying to work efficiently and that we're using a number of strategies like booking carefully, buddying up of systems. I think it's prudent to see where these efforts land us before we start to look at, what are our next possible steps. Anytime you talk about space acquisition, whether it's through partnership like we've experienced with the District of Chetwynd or through some other means, it's quite costly these days, more so than it ever has been. So as good stewards of our funding models, I think we need to ensure that we are maximizing everything we can within our current footprint before we start to look elsewhere. And it also means that I am protecting space up at the hospital facility as well as a bit of overflow and a way to sort of flex things out of the clinic if I need to. Again, trying to be, as efficient and prudent with our resources. So perhaps that's a conversation we'll come back to you with, but I just wanted to flag that, you know, we are really starting to hit that point where we have to be very, very cognizant about our use of space.
Thank you.
You're welcome.
Yeah, thank you very much. I just want to hit on some of the wins that happened in our community, the foundation. I mean, the community comes together to help wherever we can, right? And that building, the hospital itself, was founded on people from the community wanting a place for us to be able to have physicians, have the nursing, have maternity, have operations, all those things that community deserves. And now we have what we got, and the wins are that we're getting less hours for diversions, less of them, and we have the physicians 3.8 to 5.3. That's another win, and the other one is 10 regular employees. So all these things start to add up. So in a small community, like you said, that we're having people that come to Chetwynd to live, to work, to enjoy what we have. So those are the things. And for one, myself, that hospital up there had all three of my children were born there. So, you know, that's meaning it. I bet you there's some people in the room that had their kids born up there too. So, you know, just that little part of community and how we share with one another is a very big part. And you two are part of the community. That's why you're here in front of us. And I'd like to commend yourselves for coming here, because it's a tough job, especially when you have the negative stuff going on, which we hear about all the time. But for that, I believe our time is just about up. And I'd like to kinanastum tanamo. That means thank you in Cree, and we serve all people here, right? So thank you very much for your presentation, and I'm looking forward to the next one.
Thank you for having us.
Okay. Bylaws, District of Chetwynd Financial Plan 2025. Kevin? Are you going to be able to turn this down?
Pardon me?
Can we turn this down? Yeah, thanks. District of Chetwynd Financial Plan 2025 to 2029, bylaws number 1184, 2025 requires first and second reading. Thank you. And third reading. Okay, there we go.
Motion for the District of Chetwynd Financial Plan 2025-2029, bylaw number 1184, 2025, first, second, and third readings.
Second. Councillor Hunt, second. Any discussion on it? Not seeing any. All those in favor? Those opposed? Got that? Recorded? Right? Okay. Thank you. Carried. Bylaw number 2, District of Chetwynd 2025 Tax Rebate Bylaw number 1185, 2025 requires first, second, and third readings.
Motion, that District of Chetwynd 2025 tax rate bylaw number 1185, 2025, for second and third. Second.
Any discussion? All those in favor? Any opposed? Carried. Let's go on to community reports. For start with the mayor. This week we had myself and CAO had a meeting with West Fraser. And it was just a meeting to find out what West Fraser needs from us and what they're looking for from the province. And it's just pure, plain out fiber. That's what they need. They need some fiber to continue to operate at 2 shifts. Right now, they're running at 50 hours a week. So there should be up to 80 hours a week, but they're not. They're just running at 50. So it was a little bit eye-opening, but it's something that we all knew what was going on in the forest industry. So that is my report for this week. Any other reports? Councilor Nelson?
No report at this time, just a question for
Okay.
you in regards to the meeting with West Fraser. Do we have a date for when the forest minister is coming to Chetwynd? Because you said, sounds like he's making those plans. And when he does come, are we gonna be able to see him meeting with any of the local forestry companies?
Yes, we don't, as for the first question, we don't have a date yet. As for the second question, yes, we will meet with the local industry and with the minister and whatever council is available at the time. Do we have a date yet, CEO?
Very tentative, excuse me, let me set the meeting, but we haven't had any kind of confirmation.
Okay, here we go. Okay, any other reports? You have a question or a report? Okay.
Just had a meeting, Southeast Elder Society, last Thursday. Update on the Vulture's house, the usage was slightly down, with 19 staying in March, most of the maternity, 10 stayed in February, and they almost calendar day. January had 6 positions stay at the Locum house. Vulture's house is for patients only, and then they have a carriage house, really one of the property that's rented away from their health for they're looking at doing welcome baskets for new doctors. This is already happening in Tumblr Ridge, and they're looking to expand to Dawson and Chetwynd. I know our local library does welcome, so I just think we're going to touch base with them to see if our library think that overlaps with that. And they're also looking at ways to be most effective in the recruitment and retention of doctors and nurses in the community and what that looks like. So some of the initiatives in Austin are like a health and wellness day. And so they're just trying to flush out. They have a little bit of fun on what that looks like in here.
Thank you, Councillor. Any other reports? Any questions for Councillor Smith? I was just wondering about what Chetwynd has done with, do we assist in any time with that basket she's mentioned?
Yes, we digest them. We have baskets, we have a variety of things that our economic development officer can develop over the years. Everything from maps to local business lists and business directories, that kind of thing. For healthcare providers, of course, there's the doctor gets a good deal on gym masses, as you know, and that kind of thing. So we're an integral part of the overall community program.
Okay, thank you. So no other reports, motion to accept reports.
Motion to accept. Second.
Councillor Hunt, second. All those in favor? Carried. Okay, to discussion items. Discussion items. Letter from the Peace River Regional District, date April 10th, 2025. PRRD Regional Growth Strategy Bylaw number 2571, 2025. Request for resolution.
I'll make a motion that council of the District of Chetwynd support the Peace River Regional District Regional Growth Strategy Bylaw number 2571.
Second.
Any discussion? All those in favor? Any opposed? Councillor Warwick, are you still with us?
Need a minute, sir.
Just waiting to see if she's still available. Few more seconds here and we'll continue because we have quorum in the chambers. Okay, onward, correspondence.
No.
Oh, what did I miss?
MLA.
MLA, okay. You want Larry Neufeld, MLA Peace River South video addressing the legislature on Northern Initial Fire Attack Crew based in Chetwynd. Here we go.
Yeah, but we heard to move to accept.
I will motion to accept.
Second.
Which one?
D.
Oh, okay. Okay.
And you second?
All those in favor? Carry. Just a question for us. Has anybody been in the legislature in Victoria?
I toured it.
Yeah, I was there when they were fighting.
Maybe when we go to BCN.
Yeah. Oh, there we go.
Somehow I've lost audio then.
We had it.
Yep, permission to vary the agenda. We'll just go on to the next one if he brings up. Motion to vary the agenda.
So moved.
Second.
Okay, we continue with our correspondence. Letter from the Peace River Regional District dated April 9th, 2025. Letter of support. Thank you, Disaster Risk Reduction Climate Action Funding.
Motion to receive.
Second.
Okay, any discussion on it? Okay, all those in favor? There you go. Information items. I went to I-13. Anything to be pulled up? Okay,
Motion to receive CII 1-13.
Second.
all those in favor? Carried. Any opposed? Janet still not here, or is she available? Kevin?
No, she's not with us at the moment.
Okay. We will carry on. Reports for action. Chetwynd Quintessential Quilters Guild.
I'd like to motion that the District of Chetwynd provide a grant in aid to the Chetwynd Quintessential Quilters in the amount of $4,500 and that the grant be paid over 1 year.
Second.
Any discussion on it? Councilor Smith?
I'm just concerned that I only have $6,200 left in budget grant aid, and that if we approve the full $4,500 for this year, if we have another request coming in, say for like a student squad prevention or something, it would be really tight in, that one goes to the other grant fees now. And so then I was thinking, just to slow it out, before
If you would like to make an amendment to it, then
I'd recommend that the district would show, my grant age would show, quintessential builders go in the amount of 4,500 and not be paid over the 3 years. Or 2. Okay, so $1,500 a year per year, 3 years.
okay, now I'm gonna ask the Councillor Hunt, is that okay with you?
Yeah, I
Because-
think it's a good idea. Everywhere's strapping out, everywhere's looking for donations.
Okay, on the amendment, all those in favor? Those opposed? Okay,
Can I ask?
carried, yeah, that is carried. Yeah, okay, on the motion now, that $1,500. Any discussion?
Yeah, I'm just wondering if
Councillor
there's,
Hunt, use the mic, please. Thank
sorry,
you.
I'm wondering if there's something that we can do, through Ellen or to help support applying for other grants or aids in community or through other providers. So if we can't give the whole amount, maybe we can help with something else.
I know from Sarah Owens already started looking for grants that they might qualify for, we'll give them any aid who wants to bring in.
Okay, any more discussion on? Okay, all those in favor? Those opposed? Carried. Okay, Councillor Beck will remove himself from the facade improvement application. RA2, facade improvement application.
So motion that council authorize the facade improvement program application for Soto First Nations 475-351 Street, Chetwynd, BC, and authorize the mayor and corporate officer to execute a partnering agreement with Soto First Nations 475-351 Street, Chetwynd, BC, and approve the issuance of development permit number 01-2025 to Soto First Nations for the building located at 475-351 Street, also known as Lot 4, District Lot 398, Peace River District Plan 8720.
Second.
Okay. Any discussion? So do we still have one? Okay. Go ahead. Councillor Hunt.
I do.
Yep.
Can you explain this to me a little bit more, what this is for?
Okay, Helene and John, correct me if I'm wrong, basically it's just our usual facade improvement plan. This one deals with Soto, and their new building, which was, deal with popping off.
Mhm.
And so they're just reading the front of it, and all this does is give us permission to proceed with the facade plan and to, join into an agreement with Soto regarding the facade. Does that make sense?
Yeah, what was the previous amount? Was it 2,500 that we gave other businesses?
No, it's fine.
Oh, okay. That's all.
Just a question, how long has this been going on for, like, the facade?
Weird.
No, I have to look back at
Yeah.
time, but I think it started in 2010 possibly with the
Wow.
health insurance or longer. I have to go back and
Yeah.
look, but, and they can get up to $5,000, but it has to be a maximum of 50%. So most of the facades are over maximum, so most receive $5,000. We're very fortunate that we usually fill all 4 applications. We only get 4 a year. So this will be the first one out for.
Go ahead, Councillor Staff.
And just one more point of interest is it's not, any of it is not, shovel money, it's not resident money, it's an EIT grant, rather than the National Trust.
Okay, thank you. So, all those in favor? Carry. RA3 Rural Community Immigration Project Peace Liard Memorandum of Understanding.
I'll make a recommendation that council approves the signing of the rural community immigration project, obviously our memorandum of understanding.
Second.
Councillor Deck, second. Discussion? Staff, you got some?
Yes, as council will remember, the last time this came up, there were some concerns. We've resolved them. The main reason that we're really wanting to sign up on this is we have 18 local businesses that are very keen on it. And so we've gone back and forth with the community futures and with Weightman's College. We will not be doing site inspections, we will not be approving or not approving businesses or their immigrants or foreign workers. We'll be just offering support through business licenses, are there any outstanding bylaw infractions, that kind of thing. And we have vetted this through a lawyer. And so we're on solid ground.
Okay. Councillor Hunt?
So we're just agreeing to this for 1 year? Because they're saying no financial obligation for the first year? Is that what we're agreeing to? Is that
Yes, that's all we've agreed to is no financial obligation for 1 year. We signed for 1 year. And we've said that any financial obligation coming will come back to your council for approval as part of the budget process.
Councillor Nelson, then Hunt.
So who will be performing the site visits?
We will not be performing site visits. It'll be community futures. It'll be whoever they decide. They have they call it steering committee, I believe. And they will be doing the on-site visits. But we don't have the training or frankly the capacity to be doing site visits. And it puts us in murky legal ground because then we're directly aiding or not aiding business. So the lawyer felt that as long as we're not going into businesses, then we're fine.
Sorry, just to follow up on that, but we do in fact have District of Chetwynd staff on that steering committee, yes?
Yes, we have Illinois community on steering committee. But they're structuring, it's still so new, but they're structuring it so that people are making decisions relevant to their own communities. And this is part of the way that we're getting around the concerns. So again, it was murky enough that when it first came to our attention, we frankly didn't support it. But because we have 18 local businesses now, I think it's going to almost 80 that want to be part of the program, it's kind of, we're kind of have a responsibility to answer to that need for our community. And if we have that many people that want to hire foreign workers, then we need to help them.
Okay. Go ahead, Councillor Hunt.
Sorry, I just want to make sure I understand this. So our function is to just support them, but there's no responsibility that falls on us?
We support them with things like, if they come to us and say, is this business a member of good standing in the community? Then we can look up their business license, we can look up if there's any infractions, and we can report that back because that's public knowledge. But we won't be doing site inspections. We're just here to, I think the best way to put it is we would be a conduit of communication between all the various parties. We've been told that the federal government is the final entity to make the decision regarding the board members, and that it won't be based locally in with that.
So essentially, we're doing for them that we would do for any other community business.
Yes, yeah, we would offer, we always offer whatever help that we can legally to anybody that comes to us. That's kind of what we're here. So we would help anybody that came to us from the summer program, and we have in the past. I mean, we talked about a minute ago about looking for grants for organizations. We do that all the time. for, facade improvements for local businesses. We're funneling those applications through. We're helping those businesses get that facade money. We have for affordable housing, we have the $10,000 a door for new housing program. And anytime we have somebody that's looking to build, we're helping them get in touch with that. So there's lots of examples of where we do this back and forth.
Just one last question.
Yeah, go ahead.
So if we would do this exact same thing for any community business or community member, why do we need this agreement?
Because this is the structure from the federal government. This is their program. And they funneled it down so that, like, so many things anymore are getting downloaded, basically batch punched to the government, unfortunately. So it's a federal government program. They've gone through, they've contracted Community Futures, which we've all dealt with numerous times, and Everyone's College to be the kind of the steering committee for the organizing committee for the steering committee, if you will. And then the local communities are offering administrative support and that kind of thing. Our economic development officer has said that she has the capacity to handle the extra time. That was another concern that we have. So we're confident that we can just help. And that's all we're doing is we're helping with another level of government's program.
Okay, thank you.
You're welcome.
Okay, any other? Okay, all those in favor? Carried. So we don't have the video or,
Try it one more time.
okay, okay.
The councilor split that to excuse yourself.
Okay. So we're good, Kevin? We could just continue then? Okay, we're going to move on.
Your worship.
Yes,
I can speak to this very briefly.
Okay.
Basically, our Larry Duco went to the House Legislature and brought up our removal of our NIPAC base. And Minister Farmer, his comments were that basically the NIPAC bases support the entire province and they're probably needed. And we're going to follow that up with Minister Farmer when he gets back.
yeah. Good, Counselor?
We have something on that?
Larry did a really good job sticking up for Chetwynd and for saying that we need to be here. And I just want to say thank you because he did a really good job.
Yeah.
And it's good to have representation.
All right. Yeah, that's great for us as a community. We just experienced a fire here in the last, 5 days, 3 days? 3 fires? Okay. So, we're right in it, and I'm sure MLA Neufeld, when he was here, when he got elected, he showed up right away. We invited him, he was here at the next meeting. So it's very responsible of him and to have our safety and wanting to care about us. That's the big thing. So I'd like to thank him too. And thanks for that, Bonnie, for recognizing that he did a wonderful job. Okay, reports for information.
Make the recommendation that the check register for the month of March 2025 totaling $582,723.88 be received.
Second.
Any discussion? All those in favor? Okay. Okay, there was no new business. At this time, I would like to give the opportunity to the public to ask any questions that was on our agenda today. Not seeing any. Adjournment.
So moved.
Second.
Yep, thanks council, thanks staff.